Hello everyone. In this video, we will talk about gonadal hormones. The gonadal hormones in male are androgens, which has masculinizing action, while the gonadal hormone in female are called ovarian hormone because they are produced by ovary, specialized thecal and granulosa cells. The ovarian hormone are further divided into two groups, estrogen and the progesterone, also called progestin. The class is progestin, and the estrogen have agonist and antagonist. Same is the case for progestins, which has also agonist and antagonist. Okay, so the gonadal hormone includes the steroids of ovary and testes. The steroids of ovary are estrogen and progestin, while the steroids of testes is testosterone. Okay, they are mainly used as contraceptives and also used as replacement therapy. Okay, they have agonist and antagonist, and some have mixed action. That is, some are agonist in some tissue while antagonist in other tissue. The mixed agonist with estrogenic activities are selective estrogen receptor modulator. Again, repeating the mixed agonist, which means they have agonist effect in some tissue and antagonist effect in other tissue with estrogenic effect are called SERM. Okay, SERM. Starting from ovarian hormones, the ovarian hormones are estrogen and progestin. Okay, the ovary is the primary source of gonadal hormone in female during childbearing age, that is between the puberty and the menopause. These hormones are regulated by gonadotropins, that is FSH and LH, coming from pituitary. Okay, and these hormones control the menstrual cycle, that is the ovarian follicle mature and secretes increasing amount of estrogen, releases an ovum, and is transformed into progesterone secreting corpus luteum. If there is no fertilization or implantation, then the corpus luteum degenerate. The uterine endometrium, which has proliferated under the stimulation of estrogen progesterone, is shed as a part of menstrual flow. Okay, menstrual flow. Coming to the estrogens, starting from the estrogen hormones, the ovarian hormones. Okay, the major ovarian estrogen in women is estradiol. Estradiol is major estrogen. Okay, estradiol. The estradiol is available in micronized form for oral use. It can also administered via transdermal patch or vaginal cream, or also administered as intramuscular injection. The long esters of estradiol are converted into estradiol, that is estradiol cypionate. This is the esters, long-acting esters of estradiol, and they can be administered by intramuscular action. Okay, intramuscular action. There is also a compound called primarin. Primarin is mixture of conjugated estrogen from biological sources. This is used for hormone replacement therapy. Okay. The other estrogens, synthetic estrogens, which has high bioavailability, include the ethinyl estradiol, ethinyl estradiol, and mestranol, which are synthetic estrogen with high bioavailability, while the natural estrogen, which is estradiol, has little affinity. So the synthetic are ethinyl estradiol, mestranol, and estrogen ester, which is estradiol cypionate. Okay, these are very important estrogen, while estradiol is natural estrogen, predominant estrogen. Okay, what are the effects of estrogen? Estrogen is essential for female reproduction development. It is responsible for growth of vagina, uterus, fallopian tube during childbirth. It is responsible for secondary sexual characteristics. Also, estrogen has metabolic effects. That is, it modifies serum protein level. It reduces bone resorption. It increases coagulability of blood. It increases plasma tag. It reduces LDL. It increases HDL. These are metabolic action. While estrogen plus progesterone inhibit the secretion of gonadotropins from anterior pituitary. What are the clinical uses of estrogens? Estrogens are used to treatment of hypogonadism. They are used to treat hypogonadism. Okay. Next function is hormone replacement. The first is hypogonadism. Next is hormone replacement therapy. Okay, in female which has estrogen deficiency resulting from premature ovarian failure, menopause, surgical removal of ovaries. In all these conditions, HRT is used. Okay. Also, it is effective in the prevention of bone loss and osteoporosis. Also, estrogen is a component of hormonal contraceptive. So, what are the functions of estrogen? They are used to treat hypogonadism, hormone replacement therapy, oral hormone contraceptive. Okay, hormone contraceptive. Okay, and they are also used to treat osteoporosis to reduce bone loss. These are clinical uses of estrogen. What are the toxicity of estrogen? In the hypogonadal females, the dose of estrogen must be adjusted carefully because if not adjusted carefully, it will cause premature closure of epiphysis and resulting in short stature. When used as HRT, hormone replacement therapy, the estrogen increases the risk of endometrial cancer. This is prevented by using estrogen with progesterone, especially progesterone. Okay, estrogen used by postmenopausal women is also associated with small increase in the risk of breast cancer and causes myocardial infarction. Okay, myocardial infarction. Also, they have dose-dependent toxicity, include nausea, breast tenderness, increased risk of migraine headache, thromboembolic disorder, just like deep venous thrombosis. Deep venous thrombosis. Okay. The diethyl stilbestrol, where it is written diethyl stilbestrol, is a non-steroidal estrogenic compound. Non-steroidal. The rest are steroidal. The ethinyl estradiol and mestranol, these are synthetic, while diethylstilbestrol is non-steroidal estrogenic compound. Okay, this compound is associated with infertility, ectopic pregnancy, and vaginal adenocarcinoma. Okay, vaginal adenocarcinoma. The next is progestin. So if we want to summarize the estrogen, we will say that estrogen are used as estrogens are used to treat hypogonadism. They are used as HRT. They are used in the treatment of osteoporosis. They are component of oral hormonal contraceptive. While their toxicity include short stature, premature closure of epiphysis, endometrial cancer, breast cancer, myocardial infarction, okay, gallbladder disease, hypertriglyceridemia, hypotension.